Dr. Marcel demonstrates the OR2 system, a high-tech navigation tool designed for real-time 3D imaging and outcome prediction. The presentation is interrupted when a construction worker named Rob is rushed into the emergency room. A circular saw has completely severed his hand. The wound is heavily contaminated with industrial debris, making immediate reattachment impossible. Marcel proposes a radical technique called ectopic banking. He intends to surgically attach the severed hand to the patient's lower leg, using the posterior tibial artery to maintain blood flow and keep the tissue alive. In the operating room, Marcel attempts to use OR2 to map the vascular connections. A crisis emerges when the AI system stalls. The screen flashes a warning of insufficient data. The software cannot find enough clinical literature to provide a recommendation for the anastomosis. The digital guidance becomes useless. Marcel stops looking at the monitors and shuts down the navigation. He relies entirely on his own technical expertise to identify the vessels. He manually performs the anastomosis between the ulnar and posterior tibial arteries, then connects the dorsal vein to the saphenous vein. The procedure is completed without digital assistance. Post-operative checks confirm that the hand has excellent blood flow and venous return. The hand is successfully banked, preserving the patient's limb and his professional future. Marcel's clinical judgment succeeds where the most advanced algorithm failed. 11-year-old Abby arrives at the hospital via helicopter. Her leg was crushed by a heavy hydraulic bucket on her family's farm. Dr. Marcel examines the injury. Shattered bone and shredded muscle are visible through the open wounds. In the operating room, Marcel connects the two surgical suite. This AI brain analyzes blood flow in real time. The screen displays the data. Only 7% of the blood is reaching the foot. Without circulation, the tissue cannot survive. Amputation is the standard medical protocol for this level of trauma. Marcel suspects child negligence and contacts the legal department. Social workers arrive to question the parents about the farm accident. Despite the legal conflict and the pressure from the administration, Marcel returns to the operating table. Just as he prepares to begin the amputation, the AI monitor flashes. The blood flow percentage begins to climb. The two system identifies a resolved vascular spasm. The leg is still viable. Marcel shifts tactics. He uses the AI's precise mapping to perform a complex vascular anastomosis. Guided by millisecond-level data, he stitches the shredded vessels back together. He restores the circulation, the limb is saved. After surgery, Abby regains consciousness. She reveals the truth. Her father had ordered her to stay away from the equipment, but she tried to help in secret because she wanted to be useful to the farm. The accident was caused by the girl's own initiative. The child abuse investigation is dropped. Abby will walk again because her doctor used AI data to stop the saw. David Sullivan, 18, is brought into the emergency room after fainting from days of starvation. He refuses to cooperate with the medical staff. When Dr. Charles attempts to examine him, David states that he is already dead. He is suffering from Cotard syndrome, a severe delusion where the patient believes their body is a decaying corpse. David tells the team that his internal organs are rotting away. Because he has legally reached adulthood, he rejects all standard psychiatric medications, leaving the doctors with no legal way to force treatment. Dr. Charles changes his strategy. He visits David's room and proposes a reboot of the brain through electroconvulsive therapy. He describes the procedure as a Frankenstein-style experiment using electricity to jumpstart a dead man's nervous system. David is intrigued by the idea and agrees to the treatment. In the procedure room, David is placed under general anesthesia. His parents watch through the glass as electrodes are attached to his head. Dr. Charles applies a controlled electrical current, triggering a brief seizure to reset the brain's firing patterns. The monitors show a surge of neural activity before returning to a steady rhythm. When David wakes up, the delusion has broken. He looks at his parents and explains that the voices have stopped. The sensation of decay is gone. By accepting David's reality to change it, Dr. Charles successfully brings the boy back from his mental grave. David is no longer a corpse. He is alive. Walter returns from a hiking trip in Yosemite with a high fever and a distinct red rash. Dr. Will Halstead reviews the symptoms and identifies the clinical markers of the bubonic plague. The situation turns critical when a nurse develops an identical rash on her neck. The hospital administration initiates a full lockdown and contacts the CDC to prepare for a mass casualty event. Halstead consults the Grace diagnostic engine to analyze the infection's progression. The data reveals that the spread pattern is inconsistent with the biological behavior of Yersinia pestis. Halstead returns to the emergency department to conduct a manual inspection of the environment. He searches the treatment room and discovers clusters of small, white eggs hidden within the folds of the hospital linens. The medical team realizes the outbreak is not a deadly contagion, but a parasitic infestation. The hospital's regular janitors are on strike, and the temporary replacements have failed to follow basic sanitation protocols. They did not change the sheets or disinfect the beds after the previous occupants were discharged. The suspected Black Death is actually a widespread bedbug outbreak caused by systemic negligence. The panic ends with the hospital administration facing a massive liability crisis. Their decision to cut costs during a labor dispute led to a complete failure of hygiene. The lockdown is lifted, but the reputation of the facility is compromised by a preventable sanitation error. The plague was never a virus. It was a result of corporate mismanagement and a lack of clean sheets. Deanna is admitted to the hospital suffering from severe malnutrition and chronic vomiting. A CT scan reveals a massive, solid obstruction occupying her entire stomach. During emergency surgery, the medical team is stunned to extract a giant, matted ball of hair. This bezoar is a physical manifestation of a deep psychological trauma. When the doctors confront Deanna about the habit of eating hair, she reacts with immediate hostility. She points to her own thick, untouched hair as proof of her innocence and demands the psychiatric team leave her room. The mystery deepens until her daughter, Olivia, enters the ward. Olivia pulls off her red beanie, revealing a head completely bald from 5 grueling rounds of chemotherapy. The sight of her daughter's bare scalp forces Deanna to break her silence. She admits she was not eating her own hair, but Olivia's. Every morning, she would find clumps of her daughter's hair scattered across the pillowcases and bed sheets. Each fallen strand served as a brutal reminder that her child was sick. To Deanna, seeing the hair separated from Olivia's body triggered an unbearable panic, making her chest pound and her entire body tremble. She began picking up the discarded hair and swallowing it. In her fractured state of mind, consuming the hair was the only way to keep her daughter whole and quiet the terror in her soul. A bizarre medical condition is finally revealed as a mother's desperate, silent pact with a disease she could not stop. Goodwin stops Marcel in the hallway to deliver a single fact. The hospital's blood supply is depleted. A standard liver transplant requires 20 units of blood, but Goodwin restricts Marcel to 7. He is ordered to perform a complex surgery with a locked blood bank. Inside the operating room, the crisis escalates. Marcel discovers the donor liver artery is too short to connect to the native vessel. He initiates the parachute technique, using precise suturing to bridge the gap between the 2 arterial ends. As he works, the patient's blood pressure collapses. The team hangs the 7th unit of blood. It is the final bag. The patient becomes acidotic, his body failing from the lack of oxygenated cells. A resident suggests calling for a senior surgeon, but Marcel stays the course. He demands factor 7, a potent clotting agent, to force the blood to thicken. He makes a tactical decision to pack the surgical site with sponges and pause the operation. He refuses to continue the anastomosis while the patient is bleeding out. Instead, he recycles the lost blood and waits for the factor 7 to take effect. Minutes pass in silence. The bleeding stops. The blood pressure stabilizes. Marcel has managed the impossible with a fraction of the required resources. He completes the transplant, proving that when the blood runs out, only technical precision remains to keep the patient on the table. Marie arrives at the emergency room, gripped by unexplained seizures. Her parents are terrified. Their son Hugo died with the same symptoms just 1 month ago. Dr. Will Harsley, the doctor who had lost paid assessment, but the insurance company intervenes. The family's HMO refuses to cover the cost of the Chicago and demands a transfer back to the hospital. Staying, he was tens of thousands of dollars in debt. Maria's father offers to sell their car and takes the job, but Maria refuses. She sees her family's future disappearing into medical bills. She decides to stop treatment and choosing to die so her siblings can have a chance at a normal life. The parents weep as the transfer payments are signed. As the nurse Maria turns to the hospital, leans over her urine collection and calls the transfer orders medical attention. The results confirm irreversible urine disease, a rare genetic disorder that prevents the body from processing specific fetal toxins. This was the main goal that took Hugo's life. Maria was not able to eat. She needs a managed diet and protein margin. The curse is a manageable medical condition. Maria stays in the hospital. Her life no longer a sacrifice for her family's survival. The truth is found in a sense, and the family is finally safe. Kai Tanaka stands over a patient, dismissing a routine appendectomy as a task beneath his skill level. He boasts about his physical fitness and his surgical precision. Mid-sentence, his eyes roll back. He crashes to the floor. The heart monitor emits a continuous, high-pitched flatline. The surgical team freezes, then moves to initiate CPR. Before a single chest compression is delivered, a loud, prolonged release of intestinal gas echoes through the sterile room. The monitor immediately changes rhythm. Beep, beep. Tanaka's heart rate returns to normal. He gasps for air and regains consciousness, unaware that his survival is tied to a public bodily function. An urgent X-ray reveals the mechanical cause of the collapse. Tanaka has a congenital diaphragmatic hernia. His colon has pushed through a hole in his diaphragm and settled in his chest cavity. His extreme CrossFit routine, involving heavy burpees and thrusters, increased his intra-abdominal pressure, forcing his organs further upward. The trapped gas expanded until it compressed his vagus nerve, triggering a vasovagal syncope that effectively stopped his heart. The team transfers him to OR 2, the facility's most advanced surgical suite. Surgeons utilize integrated robotic arms arms, and real-time 3D imaging to perform a high-precision repair. They navigate the crowded chest, pull the colon back into the abdominal cavity, and patch the diaphragm. The surgery is a technical success. Tanaka wakes up in recovery, but the silence of the ward is gone. The entire hospital staff knows the details of his resuscitation. As he walks the halls, the whispering starts. He is no longer the elite resident. He is the man whose heart was restarted by a fart. Quentin stands in the delivery room as his son is born. He suffers a sudden psychotic break, denies the child is his, and flees into the hospital corridors. He enters the MRI suite while holding a pair of metal scissors. The magnetic field pulls the scissors into his neck, pinning him against the machine. The blades are lodged near his carotid artery. The medical team realizes that turning off the magnet will cause the scissors to shift and sever the vessel. Quentin would bleed out in under 20 seconds. Standard surgical tools are made of steel and cannot enter the room. The engineering team is summoned to the robotics lab. They use 3D printers to manufacture plastic forceps, clamps, and scalpels. These non-magnetic tools are rushed to the MRI suite. The surgeon enters the high magnet zone and begins the procedure. He uses the plastic instruments to clamp the artery while the scissors are still held in place by the magnetic force. Once the vessel is secure, the team shuts down the power. The scissors are removed without further trauma. Quentin survives the surgery. A follow-up diagnosis reveals that he has neurofibromatosis type 2. The condition remained hidden until a recent change in his diet, intended to support his wife's pregnancy, triggered a metabolic crisis and the subsequent psychosis. Quentin recovers his mental clarity. He returns to the maternity ward to hold his son for the first time. The family is reunited in the recovery room. Michelle Abrams arrives at the hospital expecting treatment for a routine infection. Dr. Hannah Asher returns with a different diagnosis. Michelle is pregnant. The news stuns her husband, Sam Abrams, a prominent neurosurgeon. He immediately disputes the findings, citing a vasectomy he underwent 7 years ago. To him, the pregnancy is a biological impossibility. The medical debate turns into a crisis when Michelle develops cervical insufficiency. Her cervix begins to open prematurely, putting the fetus at immediate risk. Asher recommends an emergency cerclage to stitch the cervix closed. Abrams, usually in control of every surgical variable, is forced into the role of a helpless bystander. In the operating room, Abrams' professional detachment vanishes. He watches from the observation gallery, criticizing Asher's technique through the intercom. When Asher prepares to insert a balloon to reposition the membranes, Abrams loses his temper. He warns of sepsis and attempts to shut down the procedure. Asher remains unmoved. She tells him his interference is the primary threat to Michelle's safety and orders him to leave. Asher executes the surgery successfully, saving the pregnancy. Later, Abrams admits his outburst was fueled by the fear of repeating the failures of his first marriage. He eventually accepts his new reality and buys a baseball-themed onesie for the child. Asher confirms the final detail from the ultrasound: they are having a son. The neurosurgeon who relied on a 7-year-old procedure to dictate his future finally acknowledges the life he cannot control. Dr. Will Halstead discovers a fatal flaw in the hospital's advanced AI-2 system. He presents evidence to Dr. Crockett Marcel, proving the AI fabricated a tumor on a surgical scan that never existed in preoperative records. This digital hallucination led to a patient's death. The system was designed to assist, but instead it invented a pathology to provide the navigation the surgeon requested. Halstead takes this proof to the hospital owner, billionaire Jack Dayton. Dayton dismisses the data. He is focused on an upcoming IPO and insists on using the AI for a live-streamed demonstration surgery on his own hernia. Market value takes precedence over medical reality. Director Goodwin confirms the institutional paralysis. Because the hospital is now a private, for-profit entity owned by Dayton, she lacks the legal authority to intervene. During the live surgery, Halstead and Dr. Song take action. They access the system's backend to force a public display of its unreliability. As global investors watch, the AI begins to flag non-existent complications. It screams about a bowel perforation and predicts a 100% sepsis risk. The surgeon shows the camera the intact tissue, proving the AI is malfunctioning. The system's credibility collapses in real time, and the IPO fails. Dayton searches for a culprit to sue. To protect his team, Halstead walks into the director's office and submits his resignation. He takes sole responsibility for the system failure, shielding Dr. Song from retaliation. He leaves the Chicago Medical Center, sacrificing his career to stop a lethal technology from reaching the market. Lori Shelton collapses during a morning jog, 6 weeks after receiving a kidney transplant. Her heart rate climbs to 112 as she is rushed to the emergency room. Dr. Halstead performs an ultrasound and identifies a blood clot obstructing the blood flow to her new kidney. The organ is failing. To save the transplant, the medical team requires a CT scan to pinpoint the clot's location. Lori's parents intervene, stating she has a lethal allergy to the contrast dye. A previous scan nearly caused her death. Halstead proposes a high-risk solution, administering high-dose steroids to suppress her immune response before the the scan. The parents provide consent, fully aware that Lori could enter anaphylactic shock. The procedure begins. As the contrast dye enters Lori's bloodstream inside the CT scanner, her oxygen levels plummet. Her airway swells and closes. The monitor screams as Lori's oxygen saturation drops to 72%. Halstead enters the narrow scanning room to perform an emergency intubation. Her throat is clamped shut by the allergic reaction. Halstead forces the tube past the obstruction, re-establishing her breathing just as the scan completes. The images provide the precise coordinates of the clot. Surgeons use this data to remove the blockage immediately. The kidney begins to function again. Lori survives the procedure, and the transplant is saved. Halstead confirms her recovery to the parents. The gamble on the forbidden scan prevents permanent organ failure. Dr. Halstead pushes to enroll Ruben in a new heart failure clinical trial, but the decision triggers a violent confrontation. Maria, the patient's daughter, accuses the doctor of exploitation and demands his immediate removal from the case. She calls the police to enforce the order, stripping Halstead of his authority to treat her father. Shortly after, Ruben's heart gives out. He enters cardiogenic shock, and the medical team's standard resuscitation efforts fail to restore a rhythm. Halstead ignores the legal ban and the presence of security. He forces his way back into the ICU as Ruben's vitals flatline. He chooses to perform a stellate ganglion block, a high-risk procedure with zero margin for error. He grips the ultrasound probe, searching for the nerves in the patient's neck. The monitor shows the carotid artery pulsing less than a millimeter from the injection site. A single tremor will cause a fatal hemorrhage. While the room descends into chaos and alarms scream, Halstead guides the needle tip toward the nerve bundle. He bypasses the artery and injects the anesthetic. The erratic red lines on the heart monitor suddenly reset. The heart returns to a steady sinus rhythm. Ruben is stable. This unauthorized intervention results in Halstead's immediate disqualification from the clinical trial he fought to lead. He faces a permanent stain on his professional record for violating a direct legal order. Maria watches her father breathe again and realizes the risk Halstead took. The anger disappears, replaced by a silent, tearful gratitude. Influencer Dennis arrives at the emergency room while live streaming to his massive online audience. Dr. Choi performs an ultrasound and confirms a severe case of appendicitis. Surgery is the only medical solution to prevent a fatal rupture, but Dennis refuses to sign the consent form. He tells the medical team that his life belongs to his followers. He launches a live poll on his website, asking the public to vote on whether he should undergo the operation. The internet treats his survival like a game. The majority of voters choose no to the surgery as a cruel joke. Dennis honors the result, even as his condition worsens and his body begins to slide into sepsis. Dr. Charles, the chief of psychiatry, realizes that medical facts cannot break this digital obsession. He decides to dismantle the influencer's logic using his own platform. Charles wheels Dennis out of the ward and up to the hospital rooftop. He positions the gurney inches from the edge of the building. Charles looks directly into the camera lens and issues a new challenge to the live audience. He tells the followers to vote on a different question. Should Dennis jump off this roof right now? The atmosphere in the chat room shifts instantly. The fans who joked about appendicitis now face the legal and moral weight of a public suicide. Fear replaces entertainment. Thousands of followers begin to disconnect. The viewer count collapses as people flee the stream to avoid being witnesses to a tragedy. Dennis watches his digital empire vanish in real time. He realizes his followers are cowards who disappear when the consequences become real. Terrified and abandoned by his fans, Dennis drops the phone. He abandons the vote and pleads for the doctors to take him to the operating room immediately. Lori Shelton collapses during a morning jog, 6 weeks after receiving a kidney transplant. Her heart rate climbs to 112 as she is rushed to the emergency room. Dr. Halstead performs an ultrasound and identifies a blood clot obstructing the blood flow to her new kidney. The organ is failing. To save the transplant, the medical team requires a CT scan to pinpoint the clot's location. Lori's parents intervene, stating she has a lethal allergy to the contrast dye. A previous scan nearly caused her death. Halstead proposes a high-risk solution, administering high-dose steroids to suppress her immune response before the scan. The parents provide consent, fully aware that Lori could enter anaphylactic shock. The procedure begins. As the contrast dye enters Lori's bloodstream inside the CT scanner, her oxygen levels plummet. Her airway swells and closes. The monitors scream as Lori's oxygen saturation drops to 72%. Halstead enters the narrow scanning room to perform an emergency intubation. Her throat is clamped shut by the allergic reaction. Halstead forces the tube past the obstruction, re-establishing her breathing just as the scan completes. The images provide the precise coordinates of the clot. Surgeons use this data to remove the blockage immediately. The kidney begins to function again. Lori survives the procedure, and the transplant is saved. Halstead confirms her recovery to the parents. The gamble on the forbidden scan prevents permanent organ failure. The man arrives at the emergency room with a gunshot wound to his upper thumb. The entry room is visible. No exit hole, no bullet hole. As the medical team prepares for the scan, the hospital's entire medical room collapses under a sophisticated malware. Digital monitors go flat. The CT and MRI machines collapse. Dr. Choi, a former Navy vet, observes the patient's deteriorating vitals. He suspects the bullet has entered the nervous system and traveled through the bloodstream toward the chest. Without digital imaging, the team is forced to use analog X-rays and manual techniques. inserting a needle into the abdomen, filling it with fluid. The fluid returns clean.
Сколько бы я не просил, но ты же знала, что меня теряла. Я босиком по стеклам, бегал так упрямо. Если бы не твой милый голосок, я бы упал, сделав последний вздох. Где звезды между планетами, как будто для меня. Я каждый раз загадывал, тебя не потерять. Но больше не могу, я просто мучаю себя. Теперь ты больше не умела.
Reflection appears on the small screen. The bullet is lodged in the right ventricle. With steady hands, the surgeon makes the incision and retrieves the 9mm wrap. The hospital systems remain online, but the patient survives. Troy drops the bullet into a metal tray, the clink of lead against steel, signaling the end of the crisis. Dr. Will Halstead enters a patient's room to find OBGYN Dr. Hannah Asher recommending an immediate surgical myomectomy. The patient is 41 and desperate to conceive, making the surgery's success her only path to motherhood. Will intervenes, suggesting hormone therapy to avoid the risks of the operating table. Hannah dismisses his concerns and prepares to scrub in. Will knows a fact that makes the situation lethal. He previously encountered Hannah at an illegal drug injection site where she was recovering from a heroin overdose. He believes she is currently under the influence. He corners her in the hallway, demanding she step away from the patient. Hannah ignores him, claiming she has moved past her addiction. Will escalates the pressure, stating he will submit a formal complaint to the chief medical officer to end her career. He tells her she's putting a life in jeopardy for a fix. Hannah ignores the threat and performs the surgery. The procedure is flawless, and the patient's fertility is preserved. Afterward, Will waits for her in the corridor to follow through on his report. Hannah stops him. She reveals she knows about Will's own presence at the illegal injection site. She makes the terms of their survival clear. If she goes down for her addiction, Will goes down for his criminal involvement. She challenges him to make the call, knowing he cannot afford the consequences. She leaves Will standing alone, silenced by the reality of their mutual destruction. 11-year-old Jamie loses control during a car ride over a disputed iPad. He attacks his younger brother, punching him repeatedly until the boy sustains a shattered jaw. The parents rush to the emergency room, exhausted and desperate for help. Dr. Charles evaluates Jamie and determines the boy requires intensive, long-term psychiatric care at a specialized residential facility. However, the medical system presents a final, brutal obstacle. The family's private insurance denies the claim, and Medicaid refuses to cover the costs. The parents are told they simply cannot afford to save their son. Dr. Charles proposes a desperate legal maneuver called a psychiatric lockout. He explains the terms. The parents must intentionally abandon Jamie at the hospital. They must refuse to take him home and ignore all subsequent calls from the facility. This act triggers an immediate state intervention. Child Protective Services will take legal custody of Jamie, officially making him a ward of the state. Only under these conditions is the government legally obligated to pay for his treatment in full. The mother realizes the cost of Jamie's recovery is the total surrender of her parental rights. She will no longer have any say in his medical care or his future. The father sees no other way to prevent Jamie from causing further violence. They agree to the terms. In a sterile room, the parents say their final goodbyes. Jamie screams and begs them not to leave, but they turn their backs and walk out of the hospital. They lose their son to the state to ensure he receives the help the system otherwise denies him. Lucy arrives at the emergency room with a GCS of 3. Her car was crushed on the highway, and she is intubated. In the operating room, Dr. Marcel finds massive internal hemorrhage. He ties off tears in the small bowel and packs the liver, but her blood pressure continues to collapse. Despite receiving 10 units of blood and 10 of plasma, Lucy is still bleeding from an unidentified source. The monitor flatlines. Marcel performs manual chest compressions, his gloves soaked in blood. He demands the team keep pushing, but the heart does not restart. The room falls silent. Marcel calls the time of death at 16:17. He asks the staff to clear the room, staying behind to examine the body alone. He notices an anomaly. There is a small, clean entry wound in the pelvis that does not match the jagged trauma of a car crash. He brings in the x-ray machine and scans the corpse. The monitor reveals a metallic object lodged deep in the bone. It is a bullet. Marcel meets the parents to explain the physics of their daughter's death. Lucy was not just a victim of a car accident. The angle of entry proves the bullet struck from directly above. Someone in the city fired a handgun into the air. As the bullet fell back to earth, it gained terminal velocity, pierced the roof of Lucy's car, and severed her external iliac artery. A random shot fired kilometers away traveled through the sky to kill her while she was driving. Patient Jerome Kirk arrives at the emergency room after a high-speed crash. Dr. Will Halstead identifies air in the patient's mediastinum and skull. He links the symptoms to a cardiac ablation performed weeks prior, suspecting a perforated esophagus is leaking air into the cranium. New ED chief Ethan Choi rejects the diagnosis. He attributes the air to lung trauma and demands a bronchoscopy. Ethan asserts his authority, forcing Will to abandon his theory for a standard airway check. The bronchoscopy finds nothing. While the doctors argue over protocol, the patient's vitals collapse. His heart rate drops into the 40s, trapped air in the skull is crushing his brain. Will realizes the patient is dying of tension pneumocephalus. He ignores the chain of command and grabs a long spinal needle. Without waiting for a surgical suite or anesthesia, Will drives the needle through the patient's eye socket. He maneuvers the tip into the intracranial space to vent the trapped gas. Air escapes through the syringe, and the patient's heart rate stabilizes instantly. A follow-up esophageal scope confirms Will's original suspicion. A microscopic hole is leaking air directly into the head. In the operating room, surgeons work to seal the rupture that Ethan claimed did not exist. Ethan attempts to frame his interference as necessary leadership and oversight. Will refuses the explanation. He states that a leader's primary job is to trust the expertise of his staff. The new chief's rigid adherence to rules nearly resulted in a fatality, while Will's extreme intervention saved the life. Pete arrives at the emergency room with a massive gash in his thigh, caused by a circular saw. He tells the doctors he suffered a seizure on the job, leading to the accident. Dr. Archer examines the wound, but remains skeptical. He reviews Pete's medical history and notices a lack of clear evidence for epilepsy. When Pete refuses a week-long observation due to financial ruin, citing 3 children and a wife with multiple sclerosis, Archer takes a controversial shortcut. He brings Pete into a monitoring room and attaches electrodes to his head. Archer holds up a syringe, looking Pete in the eye. He claims the fluid inside is a potent drug that will force a seizure to occur. In reality, the syringe contains only sterile saline. As soon as the salt water enters Pete's veins, his body begins to thrash and convulse on the bed. Archer watches the monitors. The brain waves remain flat and normal. There is no electrical storm in the brain, only a physical reaction to a psychological trigger. Archer stops the infusion and reveals the deception. He explains that because saline cannot cause a seizure, Pete's condition is psychogenic, not neurological. Pete is not faking, but his body is breaking under the weight of his life's stress. The revelation backfires. Pete reacts with immediate fury, feeling humiliated and manipulated by the doctor. He refuses further care and demands to leave the hospital. Archer stands his ground. He has successfully prevented Pete from taking unnecessary, dangerous medication, choosing a hard truth over a comfortable lie.